Hi, my name is Aparna Sivaraman. I attended Rockbridge High School, and today I will be presenting on Echo Autism and the Power of Telehealth. So first, I'd like to tell you a little bit about myself. I'm a recent graduate of Rockbridge High School, which is in Columbia, Missouri. That's like halfway between Kansas City and St. Louis. Some extracurriculars I was involved in during high school include Science Olympiad, Student Council, Host of Future Health Professionals, varsity tennis, and Nu Alpha Theta, which is our math honor society. I will be a rising freshman this year at Washington University in St. Louis, and I'm interested in studying global health on the pre-med track. Some of my interests within medicine include pediatrics, mental health, and human development, and some of my hobbies outside of that include playing tennis, listening to music, and trying out fun dessert spots. So the purpose of my presentation today is to share the work of Project Echo and Echo Autism specifically, and I'd also like to show the importance of education and telehealth in action. So first, I'd like to tell you a little bit about Project Echo. So it was started by Dr. Sanjeev Arora from New Mexico after he witnessed a patient die of hepatitis, even though the disease could have been treated. This patient was a widow and she had 2 children, and so she couldn't go to the hospital and end up getting the care that she needed. So she ended up dying. And because of this, Dr. Arora decided to send out his protocols for treating hepatitis C to multiple primary care physicians around the state. And these physicians all worked together and kind of created a virtual network where they talked to each other about hepatitis C, and they developed connections in order to learn how to treat and prevent hepatitis C. These physicians ended up becoming experts on hepatitis C within 1 year, which shows how important and successful virtual mentorship could be. So this is kind of the start of Project Echo. So on the right is a picture of Dr. Arora from the Project Echo webpage. So a quote I found from their website is "All teach, all learn," which I think is a great quote that explains how the Echo model works, which I'll explain on the next slide. So the Echo model focuses on teaching by learning from one another. So it starts with a group of specialists who are very well versed in the topic of the topic that is discussed in an Echo call. From there, these specialists talk to people who are local primary care providers, community health workers, anyone who's interested in learning about a certain topic, and they work together to discuss how to treat, how to prevent, and other nuances within certain diseases or treatments. And from there, these local primary care providers go out and help patients in need. So this kind of loop of everyone learning and helping each other is called the Echo model. So the way Echo models and Echo calls are set up are they are virtual sessions, and at each session, participants present anonymous cases to their peers and other qualified specialists, and they work together to design and diagnose patients and figure out treatment plans. So this kind of helps practicing responding to a patient that comes to you with different symptoms and signs and trying to figure out what issue they have. And this allows these providers to learn how to help treat and prevent complex diseases that they otherwise might not be able to might have to refer out to a different specialist. So another quote from their website that I really liked was "Moving knowledge, not patients." So the big goal of Echo Autism and other Project Echo organizations is to focus on keeping patients close and being able to help them straight from their primary care provider instead of having to send them out to specialists, so that connection can stay close. So now I'll tell you a little bit about my internship, which was at Echo Autism. So in summer 2021, I was looking for an internship. My main goal was to work in medicine. And that's my career goal in the future. So I wanted to do something a little bit more unique where I wasn't just in a research lab or shadowing in a hospital. So in summer 2021, after researching about different groups that work in telehealth and that are interested in human development, I found Echo Autism. So I reached out to them and I ended up being their first intern, and I helped out with a lot of projects, which I'll talk about later. So just some background about autism. So autism spectrum disorder is a developmental disorder, which means it typically develops between the ages of 0 to 2, and it affects communication, learning, and behavior. And since it is a spectrum, there's a wide range of ways that autism can show. So that was another big thing that I learned from my internship. So based on 2018 data from the CDC, 1 in 44 children in the United States are diagnosed with autism. So this doesn't include children that go undiagnosed or who haven't received diagnoses yet. Another important thing to consider is that teens with autism receive healthcare transition services half as often as those with compared to those with other healthcare needs. And this is from Autism Speaks, who's another group that works with children with autism. So this kind of just shows that autism needs a little more, people with autism do not receive as much help as they could. So Echo Autism's goal is to kind of help with that and mitigate that issue. Another thing about autism is that early intervention is crucial. Since it is a developmental disorder, the earlier you catch it, the easier it is to, make a treatment plan and figure out how to help someone with autism. And then I think for me, I've grown up with a lot of close family friends who are autistic, so it was pretty important for me to learn a little bit more about autism and see how I could help. So Echo Autism is a branch of Project Echo that focuses on teaching physicians and other providers how to diagnose and assist with level 1 autism. So at Echo Autism, they hold Echo sessions, which are weekly or bi-weekly Zoom calls, and they have different kinds of sessions based on the provider. So they have psychology sessions, primary care sessions, family advocate sessions. So you can sign up for whichever ones you want based on where your care falls underneath. So basically they have specialists on a hub team, which is like all of the main specialists. They have like a primary care provider, they have a social worker. So they have people from different aspects of professional fields that can kind of give their own opinions on an autism diagnosis. So specialists from this team start off every call with a didactic presentation where participants get direct knowledge about autism, whether it's about new treatments or signs to look for. They kind of have a new presentation every call. And then after this call, a participant on the call, so one of the providers that's here to learn, they actually present one of their cases and it's anonymized, and they basically leave time for questions in a discussion portion. So everyone on the call, including the specialist and all the other participants, work together to decide if they think the patient has autism or not, which is a really cool experience just to watch. So some other work that Echo Autism does is autism research within clinics. They also collect and provide resources for families about autism on their website. And they also hold big symposium events to share autism information. So my experience as an intern was great. I learned everything I know about autism so far from this experience. I sat on many of the echo calls and I had the opportunity to ask questions, which was really cool. So I kind of got to be one of the participants and help out with these diagnoses and the cases that we looked at. I also assisted in organizing some of these weekly calls, whether it was editing didactic presentations or taking attendance. I got to help out with a lot of the behind the scenes work, which was cool. And I also helped create a resource guide about transitioning to adulthood through autism. And that was my biggest project of the summer, which was really cool. I ended up making like a 1-page pamphlet, which is now used in the University of Missouri healthcare system. So with that, I learned a lot about going from like age 12 to 16 to 18 and how there's different steps you have to take as someone with autism. So that was a very good experience for me just to learn about that. And I also wrote articles for Echo Autism's global newsletter. So the importance of Echo Autism is another big thing I want to share. So not all communities have easy access to someone who can diagnose autism. I know in Missouri, there are like 3 specialty sites and they're always backed up like a couple months. So if you make an appointment, it's really hard to get in. So there's a need for more people that can diagnose autism. And Echo Autism helps with that by teaching their providers how to diagnose autism. Echo Autism also provides a direct connection point with resources and direct education. And lastly, on a more greater scale, autism affects roughly 1% of the world, so around 75 million people. So knowing how to diagnose and treat autism is very crucial just for the world in general, even if we're looking outside of the United States. So my takeaways from this internship are that autism can show up in several ways, and that's why it's a spectrum. It could be very simple and could just be a couple behavioral things, or it could be a lot more extreme and it could be patients needing long-term care. There are also many other developmental disorders with similar signs. So I think with that, it's very important to kind of know the differences between autism and other developmental disorders, or seeing other things that could be linked with autism. So I learned a lot about things like ADHD, ADD, and other things that could seem like autism, but they might be slightly different. I also learned that early intervention is very crucial in helping setting up a plan for success, especially with someone with autism, since that's a developmental disorder. So you need to know early on like how you can help a patient with that. And lastly, my biggest takeaway was how telehealth can be such an easy way to connect providers and make lasting impacts. Echo Autism has been using Zoom and other virtual platforms since before COVID-19. So with that, I learned, you can start from something on Zoom and you can grow it to so many more people. So just a simple Zoom call can help so many patients and so many primary care providers learn how to diagnose autism and help people that might not have known they had something on the spectrum otherwise. So just some acknowledgements. I'd like to thank Dr. Kristen Soul, who's the executive director of Echo Autism. She's kind of the first person I reached out to when wanting to intern there. I'd also like to thank Melinda Odom. She's the associate director of training and outreach at Echo Autism, and she was like my internship supervisor. And then I'd like to thank everyone else at Echo Autism we got to learn with and collaborate with. So these are just some resources that I collected some of my information about. I would totally recommend checking out the Project Echo website and just learning about the other echoes they have. They have like the hepatitis C one, they have the autism one, and there's a couple others that are really cool. And I would also check out the Echo Autism homepage if you'd like to learn more about autism. I've kind of helped sort through the resources there, and they're really easy to use. Thank you for letting me present. If you have any questions, feel free to email me. And I hope you got to learn more about Echo Autism and what they do. Thank you.